talk to you about my job as a regional vet and what I do every day. I have a bunch of my tools set up here at the table. My truck all opened up here, so I'm going to explain to you what everything does up here on the table, my truck, what I have in there, and at the end we'll have time for questions. So if you have questions, just please wait till the end. We'll have 2 or 3 minutes for that. Our practice, there's 7 of us in our veterinary practice. 1 of us, Dr. Wise, does all small animals, dogs and cats. The rest of us, like me, we're large animal only. So large animal means dairy cows, beef cows, horses, pigs, sheep, and goats. So that's what we do, or the animals that we work on a day in, day out basis. It's not a 9 to 5 job. It's early in the morning till late at night sometimes, or half a day, or sometimes on nights and weekends. So our schedule is pretty variable. And this time of year especially, the days can get pretty long. As far as where we go or how we operate, our trucks are mainly how we move around the county or around actually all southeast Michigan and northwest Ohio and a little bit of Indiana, so we have a pretty big area. We put about 40,000 miles a year on our trucks. We depend on them basically as our mobile office. So besides the working parts of the truck in the back, we have our vet box, and that carries all of our tools and equipment. So it's got a refrigerator down in here. You can't see, but it's way down there. It holds about 6 cans of pop is about how big it is. It holds my penicillin in my back seat to keep me stay cold. It has a hot and cold water tank. Holds all my IV fluids. I've got a bunch of supplies up here. My mastitis or udder infection medication and gloves and suture material and stuff for surgeries, all my surgical tools and equipment and soap and halters and equipment to restrain cattle and stuff for procedures like dehorning. So it's got everything I need in there, plus some extra medication to sell to our clients. Most of the time they're on a prescription drop ship, so we don't have to carry a lot of medication to sell to them, but we do carry some things for convenience, so in case they need it. My day, basically, or my focus is on the practice, and every one of us is a little different, but I work with dairy cows for the most part, and some beef cattle, and sheep and goats and pigs. I don't do a ton of horse work. A couple of the other doctors in our practice actually work quite a bit with horses, so if you do have horse questions, feel free to ask. But my main focus is cattle and mainly dairy cattle. Most of my day, especially early in the morning, is pregnancy checking dairy cows. You guys saw the big cow over there, right? So the way we get milk is we need to get them pregnant to have a baby. That's one of the most important jobs that a farm can do, and we help our farmers out with that. We do weekly or every other week visits or monthly visits to our farms to make sure that the cows are pregnant. It's one of the most important jobs that we have is in helping our clients out, is making sure that we're getting the cows pregnant and they're healthy. When we're not doing that, or after we're done with that on the farm, then they bring us any sick cows that they have. That can be anything from a twisted stomach, which I'll talk about in a little bit, or udder infection, or uterine infection after having their baby. Sometimes that happens, or they're lame and their foot hurts. We need to work on their foot. Or we'll go into the calf area and look at the babies, make sure they're getting enough milk, and investigate any problems we had with the dairy calves. So that's basically what fills my day on the dairy side of the business. After that, we'll do all kinds of other emergencies, pull calves, look at baby goats or piglets, or look at a goat with a skin problem, or all kinds of things. So, and sometimes I'll even look at horses when I'm on emergency with belly aches or cuts on their skin or neurologic issues. It's really pretty variable what we can do when we're not doing dairy medicine. So that's basically what fills my day in and day out practice. So I'm outside in the weather, whether it's 100 degrees out or like last winter when it was sub-zero most of the time in the snow. So we're really exposed to the elements. We don't really have a nice, clean, sterile office to work in. I have a bunch of my tools up here. You guys have seen these before. Stethoscope, right? You've seen them at the doctor's office or at the vet's clinic. Mine's basically the same, only it's a little bit longer. It's got a real long reach, so I can stick it in my ears and still have enough reach to listen to a cow's belly and her heart and her lungs. The way I was taught in school, and a lot of veterinarians are taught in the field, that we don't have an X-ray unit I can pop out of my clinic and take X-rays, or I do have an ultrasound machine, but we don't have a blood chemistry machine where you can pop in and do instant blood work for the most part. So we rely on a few tools that we have that we carry with us. You know, our stethoscope, our thermometer, a sleeve or a glove. I do have a small blood glucose meter too for a couple conditions in cows. So that's pretty new for us, but for the most part, we're using some pretty simple tools to diagnose problems, plus using our head and our training. When I listen to a cow, I can hear her heartbeat. Normal heart rate's about 80, 85. It's a little bit faster than yours and mine. You can listen to their heart. We actually listen to her stomach. You guys heard that the cow has 4 stomachs, right? From the previous, did they tell you that? From the previous group, there was 4 stomachs in a cow. So the biggest one is the rumen. It's about 50 gallons. So it sits on her left side. That's where all that hay and all that corn silage and some of the mineral and grain and other vitamins that she gets, that's completely balanced for her every day. That's where all that goes to start. And when you put your stethoscope behind her rib cage on the left-hand side, and you can listen, it sounds like a thunderstorm rolling through there. And that's her stomach contracting. And that's what we want to hear on a healthy dairy cow, or a beef cow for that matter. So when her belly's happy, she's happy. This is a anti-diarrhea pill. Do you guys think you could swallow that? So these are made for indigestion and belly upsets. Cows' stomachs are extremely sensitive, especially a dairy cow. So they not only have, they're not like you and I, just a simple acid stomach. If you eat cookies or crackers or a hamburger, it just gets digested by acid. A cow has a complicated 4-stomach system that actually ferments a lot of her feed. So basically the bacteria eat it, and then she eats the bacteria. Or she eats the product of the bacteria. That's how it works. That's pretty simple, but that's how it works. So sometimes if they have a fever or another digestive issue where the feed gets wet or it changes, we have lots of problems. And usually we use these pills to help us out to calm their stomachs down. We can give 8 to 10 of these at a time to a cow that's that size. You can stack the pills in the tube and put the tube in her mouth and pop those right down into her belly without her chewing them and spitting them back out at us. So, this is the biggest pill we have. This is a bova cow. It's about a 50-gram dose of calcium for a disease or condition that we see quite commonly in Holstein cows after they have their baby. It's called milk fever or low blood calcium. It's not an actual fever, but that's what it's called. So a lot of times a dairy cow will have a low blood calcium when she calves because she's putting so much milk into her udder. You guys know that milk has a lot of calcium in it, right? So she can strip a lot of that calcium off her bones and put it into her udder, and she can actually get deficient. So we need to give this pill to her after she has her baby so she has enough calcium in her body to keep her healthy. This pill will last about 12 hours once you put it into her belly. This pill actually gets very slick when you get it wet, so it'll slide right down into her esophagus. We use this special pill gun for it. It was made just for this pill. You can slide this down into her throat and just pop it out into her stomach, or into her esophagus, then into her stomach. Sometimes they get so severely sick with that condition, we need to give an IV. This is how most of our other fluids are given too, in bottle form, not necessarily in an IV bag like you see in a hospital, because it's easier to store in a truck that's rumbling and rattling around. This is a big 500cc bottle that we can give to a cow. This is the IV tube. It's not like the clear plastic ones you'd see in the hospital, but functions the same way. You just put it right on top of the bottle. It's got a vent at the top, and it'll flow right into her vein once we get the needle in. We give lots of different types of fluids that way. Calcium and dextrose and saline solutions. You guys like needles? No? This is a 14-gauge 2-inch IV needle for cows. So it's about twice as large as the average needle they use in your doctor's office to give you a vaccine. It's pretty big. And the reason why we use such a big, large needle is cow's skin is very thick, up to a 1/4-inch thick in some spots. That's what your shoes are made out of. So that's what leather is. So we need to punch through that leather to get to her veins to give IV administration to save her. So that's what we need, this kind of tool to get the medicine in the right spot. Her jugular veins are about the size of 2 garden hoses on either side of her neck. They're really big, but we got to get to them. If we use a small needle, it's just going to bend and break, and she's going to get really mad at us. So we need to just do one poke and be done with it. That's why we use a big needle. You guys ever trim the toenails on your dog? Oh, they don't let you? Well, this is a hoof nipper for dairy cows, or beef cows too. They won't let us pick up their feet and nip them. We usually restrain them in a chute or a tilt table. We can lock their feet down and trim their feet. If you guys look at your fingernail and you got a bone underneath your fingernail, right? That's the end of your digit, your finger. Well, your fingernail is the same as her hoof, only her hoof is wrapped all the way around her finger and up the sides. So you ever had a splinter underneath your fingernail or something like that? Hit it and it really, really hurts? Well, the cows get really painful if they get something stuck up in their hoof, or their hoof grows in a crooked way and they can't walk, or they get a nail or an abscess, something in there. We need to trim that problem out and straighten their hooves out, and that's what these nippers are for. We can take the tip of the hoof off and shape the bottom of the hoof so she can walk better. So it's a really important tool to have. I showed you my stomach tube. These are my clippers. You guys need a haircut? No? These are my portable Andes clippers. They're pretty pricey, about $400, but they're probably the most durable pair of clippers you can buy. I've dropped them in water tanks, in the snow, on the concrete. The only place it's ever broke is the metal on the clipper blades there. They're very, very tough. They're for clipping the hair off the side of a cow to do a surgery. I told you about the twisted stomach condition that I see. So the fourth stomach is called the abomasum, acid, where they digest all that food and bacteria that they ate earlier or that grew into their stomach. Sometimes when the cow has her baby, about the first 30 days after that, they're really sensitive to problems. If they have an infection or something like that, they stop eating. That stomach, which is normally by their belly button, can swell up like a basketball and twist inside her belly all the way up her left side, or sometimes on her right. And we can do surgery on the cow while they're standing, just like she is. We can actually block her side with a needle so she doesn't feel it, just the same way the dentist blocks your jaw if he's going to fill a cavity. Same way on a cow with her skin. We need these clippers to clip up the hair. We get that surgery site nice and clean, all the hair, all the manure and sand and dirt, and it all scrubbed off so I can get ready to do surgery on it. That's what these clippers are for. They're really handy. So one of the groups this morning asked about tagging. This is an ear tagger, so I don't have a tag with me, but we can basically place the tag in that clasp there and put an ear tag right in that cow, whether it's a RFID radio frequency button that we can read with a computer, Bluetooth, or a big flat number tag, so we know who she is. It's really important for us to know who she is when she's running around in the herd. Have you ever seen a baby calf being born on TV or live? Sometimes when you have a calf that's being born, things don't go right, and the baby's not positioned right. Either it's coming backwards or sideways, or the head's twisted up, or the legs are folded back. And we need to get a hold of something because the calves are really, really slippery. So that's what these OB chains are for. Stainless steel chains to put on the forearm or back leg of the calf. Calves are pretty tough. They're flexible. You guys seen a little baby? You know, little babies that are newborns that are really, really flexible and how you can really curl in a ball and stretch. Well, baby calves are the same way. So we can actually manipulate them quite a bit in the uterus inside mama to get out, and that's what these chains are for, to get a hold of those feet so we can push and pull, and actually when we're ready to pull them out of mama, we can attach the handles and pull them out. And it can take quite a bit of force to actually deliver a baby calf. Cows are very tough, and sometimes it can take quite a bit of force to pull them out. The last piece of equipment I have up here is my drenchmate system. I've got a stomach tube here, or actually a mouth tube. This will slide into a cow's mouth, and we can snap this ring into her nose. It doesn't hurt her, it just holds this tube in place so she can't spit it back out. That way we can get this soft stomach tube past her chomping teeth. It goes all the way down into her stomach, all 6 feet. We can run that tube all the way down into her while she's standing in the chute. And we can attach the other end of this tube right here to the top of my pump. We can actually fill it with all kinds of cow Gatorade, hay particles that we can mix up with water and make a cow milkshake, or anything else that a cow would need. It's mainly for cows that aren't drinking and eating, that need some extra nutrition, and they're not really listening to us when we tell them they need to eat more. So we're going to make them eat. It doesn't hurt the cow. We can actually pump this full 6 gallons into them in about 5 minutes. Pull the tube right out. Questions? Yep, it's just like a feeding tube. Yep, exactly what it is. They could choke, but the problem is this tube, the bore of it's really big, and her actually windpipe is a little bit smaller, so you can't get it down there, but they're going to cough and fight quite a bit. And actually, this tube will only go down so far on her trachea, so it won't go all the way where it needs to be, where the line's marked, so it won't get all the way, even if it's in the lungs and she doesn't cough. So you're going to know if it's in the wrong tube. Yeah, like an ear piercing. It does hurt. To go to college, yeah, it's 8 years. So I had 4 years of a bachelor's degree and then 4 years of vet school. So a long time. We didn't have porcupines really around here, but yeah, we do have cows that get poke wounds or puncture wounds and they get abscesses and stuff. Yeah, we drain them out or pull things out. Sure. No, unless the cow is down and can't get up. For the most part, we put them in a chute or a rail system. The chute just catches their head so they can't go forwards and back. It holds them still. So we can actually put a halter on her head and tie her head off so we can get a hold of her vein, or work on her feet or anything else that we need to. We restrain them, yeah. Or if a cow is really, really wild, we'll give her some medication so she'll go to sleep, so she won't hurt us. Now sometimes I do see cows with broken legs. Adult cows are so big, it's really hard to fix them. Usually the time we euthanize them, yeah. On a baby calf or a smaller heifer or something like that, if the bone isn't through the skin, if it's in a leg bone that's farther down the leg, we'll put a cast on and they'll do just fine. Big cows is really hard because they're just so big. Especially if the break is higher up, like on their femur or in their shoulder, you really can't fix it. It could have, but for the most part they're pretty tough.